and welcome to Nurse Table Talk. I'm Nurse Julie.
Hi, and I'm Nurse Kathy.
And in today's video, we're going to talk about integrative healthcare and the importance and the convenience of what it is. So let's get started. So Kathy, maybe you can explain what it is and provide our viewers with a more comprehensive look.
Sure. So integrated care is coordinated care. It's comprehensive care, and comprehensive just means that it's just not one thing, it's everything. So if you've got, they're not just looking at one specific part of your healthcare, they're looking at all of it. It's regarded as seamless care, and it really is an organizational trend, especially in the United States, where we're focusing more on the coordination of services, the coordination of care, and really just sort of integrating it, I guess, for lack of a better word, into our new model, the way that we provide healthcare.
Right.
So we wanted to kind of give you examples of what that looks like and also help you look for that in your healthcare.
Right. One of the most important things I look for, and because I have new providers, is I want them to be using software that communicates from one office to the next with their specialists, primary cares, so that everybody's on the same page, So when I walk in there, it's all streamlined. I mean, that's what I look for.
Yeah, we have seen patients with 30 meds. We've told you guys that before. We've seen med lists with 30 meds. It's not unusual, not anymore. But not one person's prescribing all of those, and you guys know that you see 3, 4, sometimes more than that, different people, different providers. Well, if you're moving across systems in order to do that, and your care is not integrated, then you do know what those barriers look like, because it looks like the records from your pulmonology appointment never reached your cardiology office. Now you've got people out there trying to make a phone call to Dr. Smith's office to have that stuff faxed over while you're sitting in room number 3. And so we don't want you to go down that road. That is not good health care. We want you to have it basically, like I used an example recently as like an umbrella. So your healthcare system is the umbrella by which underneath all of your healthcare is housed. You think that's a good example, Julie?
Right. In one state that I just moved from, the healthcare was more fragmented. So really what I did was had to make copies of my medical history and take it into my providers, because I had one provider in one health system, another provider in another health system, and then my primary care was in another health system. Very frustrating. And then when I got the bills, I had to open 3 different portals, from patient portals, and then go into 3 different billing systems to find out where I left off.
I don't even know what facial expression to have right now.
It's cumbersome, and it's not streamlined. And so for those reasons, that's why Kathy and I feel so strongly about being, if you're able to and you have the resources around you with an integrative system, really look at that strongly.
So Julie, how does somebody find out if they're in an integrative service or in an integrative organization, or if they're not? How do they know? And we all know too, at this day and age, that now different organizations are sort of like teaming up, and they're becoming neighborhood community partners. And so we're always in a state of flux too. So how do they know?
Well, here's what happened to me recently, and I mentioned it in the previous my previous videos that Kathy and I did was, so I just found a primary care doctor, and I happened to stumble across this office, and I stopped and went in. I walked in, and I went up to the front desk and asked them, "Hey, do you have doctors that are taking new patients?" But then I also asked them, "Do you take labs here, or do you send them out? Do you have x-rays here, or do we need to have those refer me to somewhere else? Can you please tell me what services you do offer here?" And then are you affiliated with hospitals or, are you part of a system? And they told me, yes, they are. And the receptionist there was very informative. Hey, we're part of this. And when they gave me their brochure, not only did I see doctors, I saw nurse practitioners, physician assistants, dietitians were on staff. They were doing nutrition and wellness. They were doing chronic disease management. They had case managers. So that is part of the integrative system. It's almost like one-stop shopping, but they're looking, like Kathy mentioned, at you as a whole person.
Yes.
So
yes.
Not just pieces where you're going here and you're going here and you're going here. No, they'll refer you if they have to, but it just makes it a lot easier and more streamlined.
I think the other thing that I like about it too is that, when you're counting on your physician to make a referral to a specialist, right, you want to make sure that the information that's sent you to that specialist makes it to that office. In an integrative healthcare system, that happens because those records are sent. The reason that we're sending you in the referral is XYZ as evidenced by here's the record. And that's how you get good healthcare. It's harder to depend on a patient. We're all kind of juggling a million different life things at one time. And for you to remember nuances of when medications were changed or when you had your last whatever, or your last colonoscopy or mammogram or whatever, that gets harder. So if you're under in an integrative healthcare system, those kind of things kind of go away a little bit more. You can focus on other things a little bit. You can trust them to get that information to the next person.
Right. And I think one more important point, Kathy, that I just remembered is usually in an integrated system, like my primary care, she knew other specialists that I might need that she knows in her health system. And I'll say, well, what do you think? Would you go to that person? Oh yeah, absolutely. They're great. And they give you more confidence that they know what's going on in their system as well. And it's just reassuring. So anyway, I hope we've been able to offer a better understanding to you of what integrative care is. And if you have any questions or comments, please feel free to send a comment to the comment section and we'll get back to you as soon as possible. But thanks for watching. Hit the like button. Please subscribe. It's free and we look forward to seeing you again. Thanks again. Bye now.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.